안녕하세요. 자궁지킴이 이재성입니다. 코로나가 장기화되면서 이런 세미나라든지 학회라든지 이런 게 원활하게 이루어지지 않았는데요. 최근에는 웹 세미나, 온라인 세미나가 그래도 많이 활성화되었습니다. 예전에 국제비침습학회가 오프라인으로 열렸고, 이번 6월 16일 저녁에 온라인 웨비나로 이 하이프 학회가 열렸습니다. 이번에 하이프 학회의 주관은 APAGE, 그래서 아시아 퍼시픽 어소시에이션 오브 가이네콜로지 엔도스코피란 아시아 태평양 부인과 내시경 학회하고 인터내셔널 어소시에이션 미니멀 인베이시브 앤 버추얼 서저리라고 해서 국제 비침습 학회 이 두 기관이 연합해가지고 하이프에 관계된 세미나를 열었습니다. 이번 세션에서 제가 두 번째로 발표를 하게 됐고요. 물론 영어로 발표하는 것이지만 제가 이렇게 영어를 잘하는 편은 아니어서 그렇게 어렵지 않으니까 관심이 있으신 분들은 한번 보고 도움이 되셨으면 좋겠습니다. Hello, nice to meet you. I am Jae-sung Lee from South Korea. I am the first Chungching HIFU doctor of Korea and the first gynecologist HIFU doctor in Korea. I have treated uterine fibroid and adenomasis by HIFU during 13 years. From 2010 and now, I have treated about 2,900 HIFU cases. I have used JC and JC200 model for HIFU treatment. I hope my experience of HIFU may help you take care of your patient in your hospital or in your clinics. I will present 13 years my HIFU experience. As you know, three effects against tumor cell by treatment with HIFU appears. The first, direct thermal ablation. The second, cavitation effect, destroying tumor cell by increasing cytoplasm temperature. The third, damage to tumor nursing blood capillary, coagulation necrosis. This is the record I request of the Ministry of Health and Welfare in June 2012 for HIFU permission for uterine disease. This is issued in Korea in February 2013. After that, many doctors and hospitals have started HIFU treatment. This paper for my HIFU story. Until this year, I have reported some papers of HIFU treatment. Demographic data of uterine fibroid and adenomasis. Average age was 41 and average treatment time is 80 minutes. This paper, Journal of Ultrasound and Sonochemistry in 2015. The second paper was Journal of Ultrasound in Medicine and Biology in 2019. This table is a follow-up result of the post-HIFU treatment in uterine fibroid. The total of 918 fibroid was treated. Uterine fibroid volume reduction rate were 55, 63, 74% at 3, 6, and 12 months respectively. Decreasing symptom severity score scale and increasing the uterine fibroid symptom and quality of life was statistically significant. The figure was shown. Total of 889 adenomyosis was treated. The uterine volume reduction rate were 45, 51, and 60% at 3, 6, and 12 months respectively. Decreasing symptom severity score scale and increasing the uterine fibroid symptom and the quality of life was statistically significant. The volume reduction rate was somewhat lower than uterine fibroid. I think that the reason why adenomyosis reduction rate is lower than myoma is the measurement of total uterine volume. In cases of adenomyosis, because I did measure the total uterine volume, the patient with adenomyosis have more severe symptoms such as menorrhagia and dysmenorrhea. They are more satisfied with the dramatic result after HIFU treatment. Here I prepared some example case of HIFU. 7 centimeter case of submucosal uterine fibroid was shown. Non-perfusion area was seen inside the boundaries of the tumor. After treatment in enhanced T1 weighted MRI image. After 7 months later, necrotic lesion of myoma was disappeared in the uterus. No more myoma was observed in this MRI image. In cases of HIFU of uterine fibroid, complete ablation close to the capsule of myoma would be reduce the relapse rate. This case is a 5 centimeter case of multiple uterine fibroid. 9 months later, the volume of myoma was reduced by 88% and there was no regrowing on the margin while no relapse. 34 months later, after treatment, necrotic lesion of myoma was expulsed out of uterus. No more myoma was observed in this figure. This is another submucosal myoma HIFU treatment case. Necrotic lesion by HIFU disappeared in 3 years follow-up MRI image. Submucosal type of myoma is one of the best cases for HIFU treatment. This case is a cervical myoma. The cervical myoma was growing at high vascularity site of uterus and its nature is very soft. So, HIFU treatment of cervical myoma is somewhat difficult and the recurrence rate is more higher. First time, this patient received HIFU at another clinics. The uterine fibroid was located uterine cervix. Previous HIFU treatment was incomplete. I used GnRH agonist for 3 months before HIFU, and then lesion over 90% was treated. After 6 months later, lesion was decreased to 2.5 centimeter size lesion, about 90-70% decrease. Some cases of rapid decreasing size was related to infection of lesion. If infection occur in HIFU lesion was more friable and easily detached, like pus and discharge. If you suspect infection, Antibiotic treatment was needed until symptoms disappeared. HIFU can be non-surgical myomectomy and non-surgical adenomyomectomy, I think. This case was multiple fibroid. The size of uterine fibroid varied widely, and there were more than 20 in the uterus. For the best treatment with multiple uterine fibroid, important point is making type 1 myoma by pre-medication like GnRH agonist. Type 1 fibroid were easily treated by diffusion energy or cavitation effect. If you meet patients like these cases, I recommend that you use GnRH agonist about 2 or 3 months before HIFU. And then if cooling time is over 2 or 3 seconds and the total treatment time get enough, sufficient cavitation effect can be given to all myomas. This case is 8 centimeter adenomyosis cases. She had 2 babies. I treated the entire lesion except the safe uterine margin near the bowel. 42 months later, uterine volume was decreased to 82%. She feels very good well. Severe menorrhagia and dysmenorrhea was disappeared. 12 centimeter diffuse huge adenomyosis cases. She received 3 times of in vitro fertilization for pregnancy. Superovulation injection made adenomyosis worse. I treated near entire lesion. Uterine volume was reduced by 87%. HIFU treatment for adenomyosis is the best non-invasive treatment of choice, except hysterectomy. This combined case is a submucosal myoma and diffuse adenomyosis case. She had diabetes mellitus and her hemoglobin level is 7. Past he have 2 times myomectomy history. Levonorgestrel IUD was inserted in uterine cavity, Mirena. Submucosal myoma and diffuse adenomyosis was shown. Usually, most gynecologists treat by hysterectomy like these cases. I think that HIFU treatment can be a good treatment modality for this case. After 9 months later, myoma was disappeared. Uterine size was normalized. Menorrhagia and dysmenorrhea symptoms were totally disappeared. HIFU treatment could be non-surgical myomectomy and non-surgical adenomyomectomy. I'm really emphasizing. She had huge multiple uterine fibroid over 7 centimeter, 6 centimeter, 5 centimeter size multiple. Because of multiple myoma, uterus was enlarged to 14 centimeter length. I treated over 90 to 95% of uterine fibroid. T1 weighted MRI image shows well-treated state. 15 months later, she was embarrassed because hysterectomy was recommended by a large hospital of medical university. So she came to me. I recommend her enhanced MRI. 14 centimeter size uterus decreased 7, and all treated myoma was non-enhanced stated and no new lesion. It was a very good post-HIFU treatment follow-up state. Usually, most gynecologists use diagnostic sonography, but they didn't figure out post-HIFU treatment state. Therefore, even if the treatment is well treated, hysterectomy is recommended only by looking at the shape of the uterine ultrasound image. All obstetrics and gynecologists should know that the treatment state of a patient who received HIFU treatment can only be judged by examining the enhanced MRI image. This slide is a complication analysis for 1,807 patients. 918 cases of uterine fibroid, symptom recur of 42, new lesion of 23, secondary HIFU treatment of 9, hysterectomy of 13, myomectomy of 8. 889 cases of adenomyosis, symptom recur of 39, new lesion of 17, secondary HIFU treatment of 17, hysterectomy of 20. Complication analysis. Transient foot drop of 1, and tumor syndrome and pre-renal failure of 1, small bowel perforation of 2. In case of a transient foot drop and the small bowel perforation, I believe that mistake, for example, power control or interpretation of ultrasound image were made. The rest complication, first degree burn and second degree burn and transient hematria was transient and minimal severe. This paper published in 2018. Journal is Clinical and Experimental Obstetrics and Gynecology. This paper is unintended pregnancy with term delivery following ultrasound guide HIFU ablation of uterine fibroid and adenomyosis. In 2017, British Journal of Obstetrics and Gynecology. I checked anti-Mullerian hormone biomarker for ovarian reserve before and after HIFU treatment. There were no significant difference in anti-Mullerian hormone level between the two time point. So we conclude that HIFU treatment do not affect ovarian function. This slide is HIFU treatment for placenta accreta. I experienced 2 cases of retained placenta accreta. She had vaginal bleeding for 6 months after cesarean section. Ultrasound images show 2 or 3 centimeter mass like myoma. With HIFU treatment, retained placenta region was disappeared after 3 months. Previously, I reported HIFU treatment cases report with retained placenta. In 2016, This is Journal of Obstetric and Gynecologic Science. This is another treatment cases of retained placenta with HIFU. Incomplete abortion bleeding occur after in vitro fertilization. Dilatation and curettage was performed 2 times, but there was continuous severe bleeding. Placenta invade the anterior myometrium of uterus. Complete ablation was done for region by HIFU. After 1 month later, beta HCG level was normalized at 1 month. This is abdominal wall endometriosis treatment cases by HIFU. I experienced 2 cases of abdominal wall endometriosis treatment by HIFU. This is the first case. She had a tender nodule by menstrual cycle after laparoscopy. After HIFU treatment, the symptom was subsided. This is a Journal of Gynecological Endocrinology. Abdominal wall endometriosis treatment by HIFU ablation. The last topic is effect of a paracervical block before ultrasound guide HIFU treatment in uterine fibroid and adenomyosis. This study shows that paracervical block before ultrasound guide HIFU treatment was a cost-effective method because it helped reduce the total treatment time, ablation time, and the total energy. Also, can be helpful for reducing the excessive use of intravenous sedation. This paper will be published within this year. HIFU treatment with very good therapeutic effect and acceptable side effect for uterine fibroid and adenomyosis and other solid gynecologic disease is the best non-invasive treatment so far. But be careful for patients who want future pregnancy and informed some possibility of being in trouble of pregnancy. Enough experience are needed to make a satisfactory treatment outcome. We have to approach carefully because treatment cases are all different density and different location each other, and the treatment time and the power level are all different. I'm really appreciate your attention. I hope my experience might help you. Thank you. 네, 내용이 도움되셨으면 좋겠고요. 항상 최선을 다해서 우리 하이프가 이 많은 사람들, 환자들한테 도움이 되도록 이 하이프가 잘 안정화될 수 있도록 노력하는 자궁지킴이가 되겠습니다. 다음 영상에서 만나 뵙겠습니다.